Good morning, class. Today we'll be watching some short videos on communication in nursing. What I would like to do is have you all take out a piece of paper and jot down any behaviors that you observe. Each clip contains certain characteristics that depict behaviors that are either frowned upon or encouraged. Your job is to identify the video that depicts the most appropriate behavior for nurses. Enjoy! Sister Rose, is there Sister Rose present?
Yes, I'm here.
Name?
Sister Rose Marie.
DOB?
I'm sorry?
Date of birth?
Oh, excuse me, my dear. My date of birth is June 17th, 1937. I am 72 years old. Oh, the time has flown by.
So, what brings you here today?
Well, I've been noticing a bit more coughing these days than usual. In fact, it's been conflicted with the store owl with children.
How long have you had this cough?
Well, maybe a month, actually. The children have been in class since September, so probably since then. I remember this one time, I was trying to read.
So only 1 month? Have there been any other symptoms with it?
Not really. My nose runs like a leaking faucet, but that's been my fears, you know. I'm a teacher, so I'm used to running noses, the need for tissues all the time. In fact,
Do you take any medications?
just some Tylenol for the arthritis pain on my hip. One time when I was duty recess, little Johnny was running around. I stripped him to stop. Ever since
Do
then.
you smoke or have you in the past?
Well, back in the day, before I became a nun, mind you, there were no warnings about the dangers of smoking. In fact, I used to have a smoke with my parents every now and then. I must admit that occasionally I have a cigarette after a stressful day with the children. It's not so much that they are stressful children, but, you know...
Enough about the children. They can't be that bad. Are you allergic to any medications or do you have any allergies to food?
I personally do not have any food or medication allergies. I do, however, know my mother was allergic to peanuts. I've been lucky not to experience any allergic reactions.
Yes, very lucky indeed.
Yes, I consider myself very fortunate. After having to deal with all these allergies, I know it can get some great amounts of stress and anxiety from the parents of my students. Sending them to a place where they are not able to supervise them all the time, creating these feelings, I always try to comfort the parents and the children, assure them we are taking great precautions in the area. We have peanut-free.
Alright, well, I believe I have enough information about you. The doctor will ask you some questions if need be. Just wait here and you'll be called in shortly.
Okay, I know.
So class, does anyone have anything to say about that clip? Did you see anything wrong with the scenarios or anything good? Yes, Gretchen.
The first thing I noticed was how the nurse did not respect the patient's privacy. Instead of conducting the interview in a private and quiet environment, the nurse asked the patient personal information in a waiting room with other people around, being able to hear everything that she was saying.
Very good, Gretchen. Does anyone else have something to share? Yes, Bertha.
The body language is not correct. The nurse is chewing gum, she's avoiding eye contact with the patient, and only looking at the clipboard. The nurse's posture is terrible. She isn't sitting up straight, but slouching. She is tapping her foot, showing her impatience. And she keeps on looking at her watch like she has more important things to be doing than taking down the patient's history and other information.
Good observations, class. Body language and silence are other ways to communicate. Verbal communication is just one part. Does anyone else have anything to add? Yes, Gretchen again.
The patient tended to get off topic, and as a nurse, we are supposed to make sure we and the patient stay on track. But the nurse behaved and reacted the wrong way. The nurse tended to ignore and minimize what her patient was saying to her. Instead of directing the conversation back on track in a nice manner, the nurse ruthlessly asked another question like the patient didn't say anything at all. I was able to see that the nurse did not want to be there, and she didn't really care what the patient had to say.